Ready? Okay. Yeah. Good afternoon, everybody. How are you?
Good. Hard of hearing.
You're hard of hearing? Okay, I'll talk loud.
Yeah.
My name's Terry Montaigne and I'm from Marshall and Sterling. The board has decided to do away with your Humana plan because most of the providers in the area are no longer accepting it.
Yeah.
I can only tell you what I've read in the news about Humana. I understand they're in financial difficulties and that's why nobody's signing a contract with them. So what I'm here to do today is present 3 different options that you can change from your Humana plan into one of these. All 3 of these plans cost $0 per month, so there's no cost for your premium. Okay, so we're going to talk about Highmark, that used to be Blue Shield Northeast New York. We're going to talk about MVP, and we're going to talk about CDPHP. And as I go through this, if you have questions, just stop me. I'm here to answer all your questions. And I know a lot of times some people don't like to ask questions in front of other people. So if you have questions, he's shaking his head. You're adorable. But if you have questions afterwards, I gave you my business card. Please feel free to call me at any time with any question, because this is a big effect on all of you. Okay, our health is most important. So whatever plan you choose, we want to make sure you're into the right plan. After today's meeting, we're going to set up a time for you to get enrolled in whatever plan you choose to. And we're going to do it right back here in this room. Colleen will set up individual appointments. It'll usually take about 30 minutes, once you've made a decision, and then we'll go from there. So if you want to take your first one, it says Roadmap 2024 Medicare Roadmap from Highmark. Inside it's a plastic package, and if you pull out the second sheet. Yep, that's it. That's second sheet. Wrong packet, my dear. There you go. Next one.
You don't know me.
I don't know you, but I'm learning quick. The one in your hand.
This one?
Yep, pull the packet in the back out. I don't know why they do this packaging, but it makes me crazy. Okay, so if you open it up like a book.
When this is all said and done, it's gonna end up being one.
No, you each get to choose what plan you like.
One individual person can choose any of these 3 plans?
Absolutely. Yep, you got a choice. Because not every plan works for everybody. So this is why we're giving you the options. Okay? Okay, so Highmark, we're going to talk about the Freedom Nation plan. It's in the 4th column. You can't hear? Is that what she said?
I just left the hearing, I just left place this morning, before I came over here, and I'm gonna tell you what I spent, but I just ordered hearing aids. I'm having so much trouble hearing.
I lost mine back in October. They cost me $3,500. Another $3,500. So I went to CVS a couple of weeks ago, $500, and I'm getting used to these, so I know.
Easy. But
You wanna move up
It's
front?
very hard to hear you.
It's hard to hear me.
For me, it is.
Do you want to move up? Yeah, because this is important.
That'll make it better.
Yes, absolutely.
You can stay there, I won't bite.
He might nibble a little bit, but he won't bite you. Okay, so is everybody in this brochure Highmark?
Yes.
Okay. We're all in the same one. Okay. If you look at the 4th column, it says Freedom Nation PPO. Everybody see that up on top?
Yeah.
Okay. This plan is, if you go all the way to the left, it'll tell you what I'm talking about, the description. So the premium is $0 per month. They're going to give you a whole $8 back on your Part B. They just give it to Social Security, and your $174.70 gets reduced by $8. Maximum out of pocket on this plan is $6,750 for in-network benefits. If you happen to go out of network, but with Highmark, you really won't, because they have the National Blue Card. And I will tell you that 99.9% of nationwide providers accept this plan. So they have the largest network. If you go to your primary doctor, there's a $0 copay. If you go to a specialist, it's a $30 copay. Physical therapy, speech therapy, occupational therapy is a $30 copay. If you go to a lab, it's $5. Diagnostic testing is $50. X-rays will cost you $50. If you have like a CT, an MRI, or a CAT scan, it's $200. Excuse me, I'm on the wrong column. Oh, I'm still good. So X-rays are $50.
Hospital, I don't blame on that.
I'm sorry? Oh, no, that's okay. Here's one of the biggest benefits of this policy. It's inpatient hospital. If you get admitted to the hospital, you're responsible for $375 for the first 5 days. So let's say you go to the hospital, you're there for 3 days. You pay $375 for each day you're there. Well, let's say a couple months later, you get readmitted. All you pay, and then you're in the hospital for 5 days. All you pay is for 2 days. So it maxes out for the calendar year at 5 days. You can't pay any more than $1,875 for the hospital bill. Okay,
What about long-term care? Is that,
we'll get to that. No, long-term
Okay.
care is not covered under this.
okay,
It's covered under traditional Medicare.
Prescriptions.
We'll get there. Hold on. So that is one of the highlights of the plan. If you have outpatient surgery, it's $225 for the surgery and $325 copay for the facility. Emergency room is $100. Urgent care is $55. If anybody's a diabetic, there's all new laws that take care of diabetic medications, which is wonderful. And this one gives you $25 every 3 months for over-the-counter medications. I'm not sure if Humana had that for your plan. So there's a catalog online, or if you're not online, they'll mail you one. You can buy vitamins and Band-Aids, anything that you would kind of get from a drugstore. You'll get that benefit 4 times a year, $25 every 3 months. It does not roll over. You have to use it within that 3-month period.
You get a card for that? Or how does it work?
You just either order it online, or they'll send you a catalog. Yeah, or you call it in if you have a catalog in front of you.
But you can't do it at a local pharmacy?
I'm sorry?
You can't use it at a local pharmacy?
Some plans will allow it. Once you get the booklet, they'll tell you where you can use it. So now if you go over to the other side of the page, CAT scan,
and that's just one in care.
$150, excuse me, it's $200 for CAT scan, MRI. It's under X-rays and advanced imaging.
Okay.
Got it? Okay. So now if you go to the other side of the brochure, the second column from the last, it says Freedom Nation PPO.
Second one, the last. Here.
Yeah, just flip your brochure over. Okay, there you go. Okay, up on top, they will give you $2,000 in benefits annually for dental. This policy pays the highest out of all 3 of them, and we're going to talk about. So they give you $2,000 for dental. It's a $45 copay for hearing. All the hearing aids are usually $699 or $999, no matter which carrier you're going with. Vision exam is $25. They'll give you $100 annually towards your frames and lenses. Chiropractor care is $15 copay. Podiatry is $30. Everybody, all these policies cover silver sneakers. I don't know if any of you are involved in that with Humana, but you all have a free membership to the Y. Now, here we go with the drugs. This is very important. For tiers 1 through 3, preferred generics, and formulary drugs, there's absolutely no deductible.
Right here.
If you get into tiers 4 and 5, that are the really like the brand names and like the more expensive cancer drugs and things like that, there is $125 deductible. Once you satisfy that deductible for those tiers, then your copays kick in. So on this plan, a preferred generic is a 0 copay. Tier 2 is $8. Tier 3 is $42. So those are your basic costs. If you do mail order, tiers 1 and 2 for a 90-day supply is a 0 copay. It'll cost you nothing. And then tier 3 is $42. Well, actually, they'll give you a little bit off. They usually charge you 2.5 times instead of the full 3 copays. And that's as long as you do your mail order. So that is basically the Highmark plan. So the highlights of this plan is the hospital benefit and the dental benefit. So if those things are important to you and the drugs, that's what you want to concentrate on.
Oh, hospital benefit,
Yeah,
the hospital benefit, what was that again?
it's $375 a day for the first 5 days, and that's max out of pocket. So if you're in the hospital for like 3 days, you pay $375 for the first 3 days. Then if you get readmitted and you're in the hospital for 5 days, you only pay an additional 2 days.
Now, through Humana, it's only 200. And I'm saying.
Right, yeah, this is one thing you gotta understand is group coverage is totally different than individual coverage. So there's a huge difference,
There's
unfortunately.
nothing at all here for additional, care. Nursing care or
Nursing home, no,
none of that.
right.
How about if you have to have in-home, physical therapist or therapy,
Therapy is covered, absolutely.
but there's nothing at all for seniors for nursing home or.
There's not a nursing home benefit, correct?
Medicaid should cover that, I don't know.
I'm sorry,
I said Medicaid should cover that, right?
Absolutely,
After that,
yeah.
After this is just a primary.
because don't forget, you still have a traditional Medicare A and B. So you have both.
Yes, I do.
Okay, so that's Highmark. So let's move on to MVP. MVP, you want to open up what's called benefits at a glance. It's inside that packet.
And one,
No MVP, Bruce. The folder.
what is it? We all have benefit for the grant.
Where's the MVP?
It's the one on the floor.
I know my
Underneath.
hurts already, when you started.
It's in that big folder.
How come that floor is so far away?
I don't know, it just jumped out there.
Yeah, well. It's like.
So this is MVP.
Well, that one, I don't know. That's-
You don't have it?
You got it.
You have it or no?
Yes.
Oh, okay.
Benefits of the glance?
That's it.
Which one are we looking at?
And we're gonna look at the first column. It's called Medicare Well Select with Part D. Yep.
Well selected.
Yeah, Well Select with Part D. I know you do.
Oh, thank you.
I'm here to help.
What did it say? No, no, no.
They go in the other folder. I bet everybody else heard me except you. What'd you say? You want to borrow my left one? I'll keep my right one.
Very, yeah, 675.
That one.
No, these are rechargeable.
Oh,
So
no.
we're in this first column,
All right,
okay?
go on.
Do you have, that's not it. Let me see.
You-
No, you got, there's another brochure in there called Benefits at a Glance. There you go, that one. Pay attention, boys, there's gonna be questions after class.
It's not a set.
No, there's no test.
Okay.
We should have took a college degree before we came here.
Okay, so this is MVP. MVP has the second largest national network underneath Highmark. They are with the Cigna network. Okay, so as long as you go, if you're traveling, first of all, traveling emergency care is covered no matter where you are. But if you're out of state and you want to go to a physician or you have to have an eye appointment, you have to make sure whatever plan you choose is in network with that doctor, okay? So MVP is again a zero copay. There's no monthly premium for this. You go to the doctor, it's a zero copay for your primary. It's $45 for specialist. Mental health is $10 copays. Now, all of these plans, they don't list every benefit. There's, additional benefits back and forth, like they all cover virtual if you're online with the doctor. There's a zero copay for the virtual. Eye exams are zero copay. Hearing exams are zero copay. Chiropractor is 50. Outpatient speech therapy, occupational therapy, physical therapy is 30. Emergency room is 95. Urgent care is 30. They all have an ambulance benefit. They just,
No.
What does this second line mean? There's in and out. What is
Right,
out?
so the in means you're in network. That means you're going to a provider in network. If you happen to go out of network, then you pay a higher amount.
Okay, but will places that are out of this network, will they take those?
If they accept Cigna, yes,
It
absolutely.
still has to be if they accept it though.
That's correct. If you're going out of network, no, if you go out of network and they don't accept Cigna, then you pay the higher rate.
But if you go to a particular, if you're out of, you go somewhere, you end up somebody you don't know where you're going, and if you go in there and then you find out that they don't accept MVP, then you're stuck for the whole tab.
No, you pay that out of network benefit. Out of network benefits. So let's say you were going to, well, you're not gonna have a primary doctor out of network. Let's say if you went to a specialist that is not in the Cigna network, then instead of paying $45, you're gonna pay
Pay 60.
$60. Correct.
But if, what I'm missing is, if this particular doctor that you went to is out of the network, and you pay 60, who's gonna pay the rest of that doctor?
MVP. They pick up that,
Oh, okay, they pick it up even though they don't normally cover that doctor.
or that's why it's
You just-
considered out of
I
network.
agree.
That is
I
correct.
agree.
Yep, absolutely.
Okay.
Where'd we leave off? Emergency room, okay, we covered that. Non-urgent and non-emergency admissions, you could pay up to a $60 copay for office visits. Hospital stays, now this is important for all of you. It's $325 for the first 5 days. If you get readmitted after you're in for 5 days, you have to start this cycle all over again. So there's no cap on this. So anytime you get readmitted to the hospital for how many days you're in there, you have to pay the $325. Observation, this applies to all of them. If you go to the emergency room and you stay overnight for an observation visit, there's a flat $300 copay. If you get admitted, they waive that $300, so you wouldn't have to pay that on top of a hospital stay. Ambulatory surgery is $300 for the surgery and $225 for the facility. X-rays are $50 copay. CAT scans, MRIs, PET scans are $150. Labs are a $0 copay. If you're having a diagnostic lab, it's $20 copay. And this one max out of pocket is $75.50. So you can see just between Highmark and MVP, Highmark specialist is less. Their emergency room is like $5 more. It's $50 more on Highmark if you're having an MRI or a PET scan. So these are things you need to look at that everybody's going to be affected by differently. So if you're somebody that goes and has CAT scans on a routine basis, you might want to look at the one that's going to cost you less. Now, if you flip this over, let me just see how we're going to do this. Yep. Flip it all the way out to this page here. Just open it up like a book. And it says Part D drug coverage. And we're in the first column under Well Select. Everybody there? Okay, so on this plan, you have a $250 deductible for tiers 3 through 5. So this might be a big decision that you want to make between each one of these carriers. So it's a $0 copay for your preferred generics, $12 for regular generics, $47 for formulary. And then after that, it's 25% after the deductible for tier 4 and 27% after tier 5. So that's one of the differences on the drug coverage between Highmark and MVP. Now, if you flip the book closed like this, just fold both ends like this. Okay.
What are the different tiers? Tier 1, tier 2?
Tier 1 is preferred generics, tier 2 is a generic, tier 3 is formulary, tier 4 is non-formulary, which those are the big expensive brand names. And then tier 5 is like more of the cancer drugs and the things like that.
Oh, okay. And now, what is, this is all, if you have Part D Medicare?
No, this is Part D. This is
Oh,
included.
this is included,
Right.
okay.
These
Okay.
advantage plans cover everything. You don't need anything separate. If you, whichever one you enroll in, you've got coverage for everything.
Okay. Thank you.
You're welcome. Okay, everybody got the book closed like this? Now, MVP will give you, we're on the left column, they will give you $1,500 for dental services during the year. Yep, flip that other page open. Okay.
Back, okay, I see.
If you fold the lens in, we're in the first column here.
There you go.
Where were you in fifth grade?
Well, you didn't listen to me none.
Okay, so dental services, they're gonna give you $1,500 under this policy. Hearing aids are $699, $999, just like Highmark. Eyewear, they're gonna give you $150 allowance towards your frames and lenses. So see, Highmark charges $45 for a copay for your vision, $25 for your vision exam. And they'll give you $100 for your frames and lenses. This plan charges you nothing to have an exam, and they'll give you $50 more towards your frames and lenses.
Well, I get yours.
Another big perk of this plan is they're gonna give you $75 every 3 months for over-the-counter products. The vitamins, the Band-Aids, things like that. Shampoos, you know, they have catalogs, as I said. Transportation, they provide 24 one-way rides per year to a medical appointment. They all offer this meal delivery. If you get hospitalized and you get sent home, all the carriers are gonna send you 14 meals to make sure you're eating right after you get discharged. As we said, the virtual is $0. Free silver sneakers membership, that's the free Y. On this plan, once you go to your doctor and get your annual physical, they're gonna send you a gift card for $100 just for going to get your physical. Because they want you to stay healthy.
Yeah,
Oh,
I don't get that.
You don't get that? So that's MVP. So does anybody have questions on MVP?
Okay.
So far, between these two that you've discussed and stuff, we're losing a ton of benefits. I mean, these and what we have in the plan, is that correct?
I told you there's a big difference between group plans and individual plans.
Let me also, which we did not point out, out-of-pocket maximum, because it's a drastic change in Humana. The out-of-pocket maximum for medical expenses was $3,000. With these plans, it's up at $6,000 or $7,000. If you hit that, you can provide us with paperwork and we will reimburse you. This is just on the medical part. We'll reimburse you anything between the 3,000 and say the 7,000.
We being
Well, the town.
the town of Lake Luzerne.
Yes, so that's what the town board passed when they picked these plans. Because of the high out-of-pocket maximum, if you go over the 3,000, that would have been with Humana. They will reimburse you up to the, I believe it's.
Is it
6,000 or
37.50 or 37? Yeah,
So,
something like that.
37.
Any one of the
It's
plans.
Up to about $3,700 a year, they would reimburse you if you incur those costs. Out of pocket.
So if there's somebody that's really sick and they're going and they're getting multiple MRIs or CAT scans, you might hit that 3,000 quick. So then you've got the town that's gonna reimburse you by just sending in your receipts. I'm not sure what procedure you have in place yet, but I think,
Right.
is it an ICHRA or an HRA? HRA,
I
I
think we were
believe.
talking HR.
Yeah, HRA.
But this is something that the town picking up on their own for retired or for these.
Right.
That's
because
the benefit of getting old.
Because
How's
when
that?
they looked at the plans, they saw the drastic out of pocket change. So they want to cover that for you. Because I think the idea is there.
I'm sorry.
Meds
included.
No drugs included, just medical services.
As long as we're with these plans, that's what goes, that's right now what they have said. That's in the resolution to take these plans is to pay up to $3,750. For medical expenses out of pocket.
And while she's talking about that, just so you know, these plans will be effective June 1st because coverage with Humana is ending May 31st. But come October 15th is when we can start sharing information for the plans for 2025. And if you're not happy with your plan or you want to see what changes are being made, you just call me and we'll get together and I'll show you, are you in a good plan? Do you want to change? Do you have different, health needs? So you're not tied in to this forever. It'll be the last 6 months of the year and we'll go from there.
If if someone elects to choose one of these plans and 6 months down the road they're disappointed, are we still stuck with the plan we chose?
No, on October 15th, the new
That-
information comes out, and then I can write you a plan for the new January. So you're in this plan for 6 months, from June 1st to 12/31.
Okay.
Then for January, if you don't like this plan, you can make your
You can
change.
Elect one of these others.
Correct. Yeah. Absolutely. That open enrollment period for January goes from October 15th to December 7th. So as long as you make a decision by December 7th for January 1st, you'll be in that new plan that you want. And you know, they're always making changes. They're always trying to improve benefits, which is good. Any more questions before I move on? Okay,
Over the
I'm sorry.
meds.
Yeah, didn't I just go over the meds?
We did.
Oh, what do you have a question about?
I'll ask you later.
Oh, okay. Yeah, not a problem. I'm not running away, I promise you. I'm all yours. Okay, now CDPHP is in that big packet. And you need to pull out the flyer that has those people. You got it, my dear.
For the first time.
For the first time, you'll get the booby prize. I
Okay.
promise.
Get the home to wear on.
PHP is the next one, Bruce.
Oh.
And we're looking at the first column in gray. This one here. Yep, the first column in gray. Oh, here comes Pokey. Let me help you.
Yeah, but I'm trying to, so.
That's great.
At least look
Are
at
we all
that.
handicapped at a time?
Yeah, shit.
There you go. Are you good?
Here, Mama,
I know, there's so much information. But I'd rather give you more information, when you go home and make a decision.
Yeah. I wouldn't, but you don't understand from over like 6,000, I think. There's no six, but I just.
Does this package include the paper for the site at home?
We can do it over the phone, you don't have to come back in.
Okay.
Yeah.
Something to evaluate, but I just had.
Well, they just have extra information in there. So we're in this house.
What I said to you last week, I said, okay, so wait, I had verified.
I don't have.
Okay, are we all on the same CDPHP? I just had a question.
Different.
The difference.
I just had a question. If there was enrollment materials in your package to fill out paperwork, you don't need to fill out any paperwork. If you don't want to come back in to get re-enrolled, we can do it over the telephone or we can have a face-to-face meeting.
They're trying to word flag up.
All right, folks, let's talk about CDPHP. Gray column, it's called CDPHP Vital RX. Excuse me. This again is the 0 monthly premium. The column on the left is your in-network benefits. The column on the right are your out-of-network benefits. CDPHP has the Magna Care network, and I'll be very honest, it's not as strong as Highmark and MVP. But if you're somebody that likes CDPHP, then you go with this plan. So if you go to your primary doctor, it's a 0 copay. Virtual visits are 0. Specialist is 45. Your routine exam, everybody gets a 0 copay for that. Urgent care is 55. Emergency room is 90. Ambulance is 265 on this one. It was 200 on MVP. Outpatient surgery is 335 for the surgery and 360 for the facility. $30 copay for physical therapy, speech therapy, and occupational therapy. Hospital benefits, this again, it's 360 for the first 4 days, but if you get readmitted, the cycle starts again. That's why the Highmark one that we talked about, if somebody is in the hospital quite a bit, you might want to gravitate towards that one. Dental allowance, this is a nice perk of this plan. It's $850 allowance, but CDPHP gives you a MasterCard loaded with the $850 right on it. So anytime you go to the dentist, you don't have to fill out paperwork. You just swipe that card and as long as that balance is there, it'll just take it off of it, which is nice. Vision exams are 20. They'll give you 150 towards your frames and lenses. Hearing aids is $599 to $899. The OTC benefit is also on a prepaid MasterCard. It's $25 a quarter. Silver sneakers is included. This one you can earn up to $125 with life points. And what that means is you'd have to go on the computer and create a profile. And they have these little quizzes. And every time you take a quiz, if it's worth 10 points, it's $10. So you could earn up to $125. Lab work is $5. X-rays are 40. CTs, MRIs, CAT scans are 165. And this max out of pocket is 7,500 on this plan. So you can see Highmark is 6750, MVP is 7550, and CDPHP is 7,500 max out of pocket. So back to the question about the $3,000. If you're enrolled in this plan and you hit $3,000, then the town's gonna cover, I think is it 3,750 they came up with? That sticks in my mind.
Well, it's depending on the plan. This one would be 3,500 because it's out of pocket max is
Okay.
3,500.
So keep that in mind. Now, if you just flip this over, no, open it up like you did. Now fold the page and there you go. Now you want to be on this side here. Just make sure. Oh, yeah, you're there. That is not the wrong book, but I don't know why they came out to
Confuse people.
Absolutely, they confuse me.
You know, it's already there.
Make sure everybody's got the right book.
Now, Bruce, we're going on to pharmacy, Bruce.
There we
Same
go.
paper.
Yeah.
You just gotta open it up and turn it to the pharmacy next page.
I don't.
You're just trouble, my dear. And I like that. I always like a challenge. There you
One
go.
in every group.
I love a challenge. Absolutely. I'm never bored.
Yeah.
You know, if you know I'm not bored. There you go. Are you all set over there?
Yeah.
Okay. What are you doing? Making a mess? Leave the church till the end.
No, we'll stand.
Okay, so pharmacy coverage for CDPHP. There's a $300 deductible on tiers 3 through 5. Preferred generics is 0, regular generics is 0. Tier 3 is 47. It's $100 copay on tiers 4 and 26% of the contracted rate on tier 5. Okay, so let's say you're on a generic medicine. I mean, are there meds that you're getting now that cost you nothing?
No, of course.
And what do you know, what's your norm?
Tier 5.
Oh, they are tier 5. So then we gotta look at your, and I will sit down when we do this and go over your drugs to see how much they will cost for you. Because there's another thing we're gonna talk about when we get done with this. It's called the donut hole or gap coverage. Has anybody heard of that? Okay, well, we'll get there. If you do mail order, obviously you're gonna save money.
If you don't do mail order,
Yeah, then you just pay the regular copay. So in other words, if you're on generic medicine, it's gonna cost you nothing.
my question wasn't going to be the dollars or cents. My question was going to be, do these other agencies that you just discussed? My pharmacy right now, I'm on a 90-day automatic refill plan.
Correct.
Do they,
That's what mail order is.
this is a mail order?
It's through your pharmacy. As long as your doctor writes the script for 90 days, your pharmacy will fill that. Yes.
Okay.
Yep, absolutely.
So it's a doctor pharmacy decision, not a
Correct,
facility decision.
correct. All right, so who's got questions on CDPHP?
What would the RX deduction tiers 3 through 5 mean?
So if you're on a tier 3 medication, you have to pay the first $300 up front. That's your deductible. And then after that deductible, then you have a copay. So on example for CDPHP, let me just get back to the right page.
Anything that's not a generic, it's going to be possible.
Anything that's tier 3 on CDPHP is 0. That's correct. But that's like that for all the carriers. They're very, little co-pays. What did I just do with my?
Bruce, you wanna go help her find the page she's looking for?
Okay, so on this CDPHP, if you're on a tier 3, you pay $300 up front and then $47 for that medication. But once your deductible's paid, that's paid for the year.
What's all the,
Okay, so you go, let's just say your medicine's tier 3. You go to the drugstore to pick it up your first time. Yeah, it's gonna cost you $347. You pay the deductible first, and then you pay that copay of $47. Now, next month, when you go to get your drugs again, you're gonna just pay that $47 because you've already paid the $300
now
deductible.
how about tier 5?
Once you use that deductible, that's it. You only pay that deductible once. So whatever the cost of the medication is 25% of it. That's when you're gonna pay what you're gonna pay the contracted rate.
It's still gonna pay 25%.
Correct.
Yeah.
Yeah, but we're gonna talk about this because this is a big thing going on. So do we have any more questions on any of the plans? Because then we're gonna talk specifically about drug coverage. Boy, you are great students, and I love your questions too.
No, actually, I think, I don't know if I speak to the rest of these people about that. I think we are asking a lot of questions. We're all totally.
Well, I don't want you to be confused, and that's why you've got my phone number, and I'll even come back and meet with you again. That's not a problem. My job is to help you understand all the different options. Don't put your glasses away yet.
I like going to halls. I don't mind, usually when I get home, you look at.
You understand it better when you're by
Yeah, yeah, it's me, I'll sit down and absorb it more.
Yes,
like
you
go
look them over
forward.
about it, and if there's something you don't understand, then I'll, the whole thing. Well, I'm gonna let you read it. Just, I'll make it up to you.
Well, some of this, here, a lot of it. you're
And that's one Humana's not
paying
taking
in
anymore. I mean, they're not taking Humana.
Playing case that crap.
I hear you.
If you sit down and study it, then, some things that this won't cover, your Medicaid will cover.
Yeah.
So it's kind of vice
Norman,
versa.
Norman, there you go.
Oh, thank you.
More reading, Gary, but.
Right now, you all really have to pay attention.
Oh, we're together, hon.
Oh, okay. You have to pay attention. This is extremely important. This is called the donut hole or the gap coverage, and nobody has this now with their current plan. And this is only gonna be through June to December because next year there's changes that I'll talk about. So the way you get, this whole thing works is you have to get to the initial part of the plan, which is $5,030. And how you get to that $5,030, excuse me, is whatever your copay is. Let's back up. Let's say the contracted rate of your drug is $100. That's the contracted retail rate is $100. Your copay is $25. You pay $25 and the insurance carrier pays the $75. And that $100 goes towards that $5,030. Everybody understand that?
Mhm.
Okay. If you hit, and in your case, you're going to, so that's why I want you to listen. If you hit $5,030, now you're in what they call the gap coverage. Now you're responsible for 25%. Wait, it gets better real quick. You're responsible for 25% of that contracted rate until you hit $8,000. So if the medication contract is $1,000, then you would pay $250. But the difference between that $5,030 and the max, the $8,000 is $2,970. Whatever you paid out of pocket for the first stage, not what the insurance company paid, but whatever you paid in co-pays out of that first stage goes towards that $2,970. So let's just say you had $1,000 of co-pays. Now you only have to pay $1,970. And if you're on tier 5 meds, you might have to pay it once and then you're done for the year.
Now, for example, I have one that's $985 copay.
You pay that now with Humana?
Yeah.
Do you not have, is there gap coverage?
No, we actually, we went with a better prescription coverage.
And you're still paying $900.
985.
Is your copay or the rate of the
No,
drug?
that's my copay.
Okay. So you're gonna hit this donut hole really quick, but you'll max it out also very quickly. So
But
we'll,
then after that, still pay 25%.
once you hit that $8,000 total, you're completely done. But you're not paying 8,000 altogether. You're paying whatever you paid for prescriptions in the first 5,030, not what the insurance company paid. So you take that off of that difference of the $2,970. So an example, let's do this. Let's say you paid $1,000 in copays, just the example. So now you're down to $1,970. So you're paying 25% of that $1,970. Once you hit that, you're done. And they pay for the rest of the drugs for the remainder of the year. Now, this only applies to this year because as of January 1st, 2025, under the Inflation Reduction Act that's in Congress right now, max out of pocket for prescriptions is going to be $2,000, period. I don't know the details of how it's working. They haven't released all that yet. You know, they've got all rules in Congress back and forth, but max out of pocket will be $2,000 moving forward. Whoever created this should have been shot because for anybody to understand it, it took me months for it to sink in to really try to explain it. And that's why I wrote on the bottom, I tried to make it very easy for people to understand, and still it's very confusing.
Yeah, I think a lot of it is confusing till we get to a standard, what we were just talking about. If that goes with all insurance things and stuff.
Absolutely.
Take the confusion out of it.
Well, I'm trying to remove the confusion and give you the straight facts. Yes, sir.
I throw a monkey wrench into it.
You can throw a monkey wrench into it.
Approximately 6 years ago, my wife had fatty liver, non-alcoholic. One prescription was a little over 700 a month. And, so I reached the donut hole. And in the process of that, I called the insurance company and I said, when you pay for the prescription and I pay the other half, why do you add mine in with yours? In some cases, you get into it quicker, and other times you don't want to get near it.
Right.
And so I asked them why, and they said, well, it was the only way we could keep track of what pills were being sold and the price per pill. I said, the federal government knows that.
Absolutely.
So I was tipped off to, with the nurse that came to the house to sign up for Epic.
I was just gonna mention Epic. Yep. Yeah, there is a program out there. It's Epic. It's elderly persons, something. Based on your income, it can lower your out-of-pocket expenses for your prescriptions. Are you on Epic by any chance? Have you ever heard of it?
Not going to now.
Okay.
My understanding in New York State, someone helped.
Oh, it could very well be. I'm licensed in New York, Vermont, and Massachusetts, so I haven't dealt with Epic in the other two states.
Cause I went from $700 to $20.
That's huge. But Epic, like I said, it's based on your gross household income. And you can go online and just Google, is everybody a computer savvy in here?
I think the max you can make is $100,000.
Is it an individual or a couple?
Not sure that, a couple.
Okay.
Yes, yeah.
So you can Google Epic and find there's an application right online. And you should do that sooner than later with the cost of your meds. You have a question, dear?
No, I was just wishing I had a pen so I could write this down.
Oh, I have tons of pens.
Thank you, honey. We got one, thanks.
Yeah, you might get some stuff, I don't know if you get AARP information, but they got a lot of.
Can you get the application at the drugstore or?
You might get it at the drugstore. You can get it online, I know for sure. Absolutely.
When I had hospice.
I'm sorry.
I said when I had
Read the name, but I don't know
the
where
nurse sent the application.
Oh, okay. Yeah, some people carry them around with them. Absolutely. Colleen, you have anything to add?
I don't think so. I mean, I know that the board
Yeah.
had good intentions. I'm hoping this all works out well. Terry, I think is a great, asset for us. She knows a lot of stuff. So please reach out to her with any questions that you have. As always, I'm here for you if I can do anything. But we can, today was mainly for information. Call her with any questions and then we will set up when you guys can get enrolled. And she will help you get enrolled.
So you're gonna come back here to do the enrollment?
We can do it here. I can do it over the phone with you.
No, with her, it's better if you do it here. 'cause she
I
doesn't-
prefer in person, but some
Yeah.
people don't want to travel again, and I understand that, so I am very
Took 2 minutes
flexible.
up the road, so.
Yeah, no, I have no problem coming back up here.
Okay, so we'll have, everybody will come at the same.
I do all the
time?
enrollments online, so I just sit here with my computer. The paper enrollments are a pain in the butt. They really truly are. It just takes too much time, then you gotta mail them in, and you know what snail mail is like.
Yeah,
When I enroll somebody, I push a button, it goes automatically there. You get a receipt saying that you've been enrolled, and then they'll give you, usually takes 7 to 14 days to get your ID cards and your new policy.
think how many you'll.
I'm sorry?
Okay.
Yes, okay.
Yeah.
Now, I recommend, this policy ends on May 31st. So I was talking to Colleen and I would suggest that we start doing meetings the last 2 weeks of April. Only because I don't want anybody not to get their ID card and have a policy for June 1st.
Oh.
So if that works for you, what Colleen's gonna do, and like I said, it usually takes about 30 minutes per appointment, so maybe we'll do 45, it just depends. And then we'll just set up a schedule, even if I have to come back up another day, if we can't fit everybody in one day. But I'm an early riser, I only live an hour away, so we can get started whenever. Oh my God, this room got so quiet all of a sudden.
Everybody's thinking.
If anyone has a visiting nurse come to their house, she can fill out the form.
Yes. Did you hear that, folks? If anybody has a visiting nurse coming to your home, she can fill out the Epic form for you.
I used to do it.
Both of us too, we don't have.
And nobody ever suggested Epic to you before? Not your pharmacy or any of your care providers? That's what's wrong with this world. There's not enough education. No, and there's no, you call Social Security and they act stupid when you call them. I mean, they don't know different things. Sorry to say that, but it's
No,
true.
it's true.
And only because I deal with them myself.
It's true.
Can I ask you to do a favor? Maybe all of these people will appreciate it. If they don't, I apologize to the rest of them. I'm totally at a loss. I understand and I honestly compliment the town of Lake Luzerne for taking the initial step they've taken in the extra coverage they're offering and stuff. But how about with the people we have here right now?
Mhm.
If someone has a comment they want to make about one of these outfits, whether it's good, bad, or indifferent.
Absolutely.
If
The
somebody-
floor is
Can
open.
we have a general talk? I won't mention names and it wasn't right here right now, but I know a friend of mine, and pardon my French folks. When I was talking about this meeting and stuff, they said, if you go, be careful, MVP sucks.
Everybody has their own opinion.
Absolutely, correct. But maybe some of these people have something good to say about one versus the other, and if it is, maybe it's something that, we would all
Yeah.
appreciate hearing.
I think a lot of it's trying to find a policy that fits your own needs, as for as much as you know down the road, because we don't right now. I mean, insurance changes, medical, appropriations change, and I guess you just find something close to your needs and say, well, that's a better plan. And all up in the air right now anyway.
See, my husband and I, we have MVP, but he's under a different. He had to retire early because of health. But with MVP, they approved a procedure for him to have, and now they won't pay the bill. We ended up having to pay.
But are you in group
$4,000
health
bill.
insurance? Are you in health insurance or Medicare?
Health insurance and Medicare,
You're on both.
yes. But neither one of them want to pay the bill now. so we're stuck with a $4,000 bill.
No, you can grieve it. You just,
I've grieved it till I'm blue in the face and in the ground, and they refuse. They will not, neither one of them paid this bill.
That's why I got the bill in the truck. I'm gonna take it to Gene Marino and have him do something with it.
That's why I was telling him to be careful, because with ours, it might be different than this one, because it's a different,
are you in an HMO or
I
a
don't know.
PPO? All three plans that I talked about are PPOs, which means that's national coverage. If you're in an HMO, that means local only, and if you go out of network,
No, it wasn't out of network. I don't know, Colleen would know better. I don't know.
Present plan is. people.
I'm sorry,
It's not a retiree plan.
it's
Yeah.
regular group health insurance.
Yes.
Well, then there's something,
Yeah,
Yeah.
I didn't know about that.
group health
Yeah.
insurance is totally different than Medicare, just so
Yeah,
you know.
well, that's, you know, I just wanted them to be prepared to ask these questions. you
Absolutely.
know, Because,
I will tell you, since January first, I think I've written like 63 Medicare policies. I'll say 50% of them are Highmark. A handful are CDPHP and the rest of them are MVP. So that's where, just what my clients have chosen,
yeah. I mean, we've never had no problems other than just that, and it's,
that one bill.
but it's like, you can't, how do you argue with them?
You do.
Well, you can, but they don't listen. They just say, well, it's not my problem, call this person. You call that person, they say, well, it ain't our problem, call that person. So they just keep going back
I know.
and forth.
It's disgusting. It really is.
Yeah,
You need an advocate. That's what you need. You need somebody to go there and fight.
yeah,
Absolutely.
I know, and I hate bothering Colleen all the time.
He's your advocate. That's good.
That's why I'm here for. You're gonna start locking the door on me, what's up?
Nobody's gonna lock you out.
Would you repeat those numbers again? You just made
I
a
didn't
comment.
understand what you said.
Written something like 60.
50%.
65 policies since the beginning of January. 50% of them have been Highmark. The rest of them have been MVP and maybe a handful of CDPHP.
I'm so, we didn't know. So most people go with Highmark.
Yeah.
And
Now Highmark used to be Blue Shield in Northeast New York. They just changed their name.
a friend of mine, when they found out I was coming over here, mentioned, and I showed them the letter, which one, and they said, Highmark is excellent. And then their second comment was CDPHP would be my second choice. And their comment to me that day was, think twice about MVP.
Well,
And apparently with what these folks are going through, maybe there's a reason for that.
it could very well be, right? I understand.
But Highmark is what used to be.
Blue Shield Northeast New York.
Confused on the med coverage.
On the med coverage?
Yeah.
Okay. All right, let's go over that again on Highmark.
What's that for?
So on Highmark, if you're on tiers 4 and 5, which are the more expensive drugs, that's $125 deductible annually. Once you pay that $125, you just pay the copays. But your tiers 1 through 3, you just pay copays. So tier 1 is 0, tier 2 is $8, and tier 3 is $42 copays.
42 is okay on the 4 and 5.
And 4 and 5
Check that one out first.
is $94 for 4 and 30% of the contracted rate for tier 5. Does that make it any clearer?
94.
Yeah. Now, if you go into the mail order, if you do mail order with them, then it's tier 1 and tier 2 is 0. You get a 90-day supply for 0. And it's 105 for a 3-month supply on tier 3.
Yeah, I'll read that one over.
We'll read this one first. Then you can-
Does that make it any clearer? I know people that are on like Ozempic and Eliquis, those are the more expensive drugs. Yeah, absolutely.
I take, yeah, but.
Can you explain anything more about the Epic? I mean, once you meet the donut hole with your insurance, Epic has a donut hole too.
I'm not familiar with Epic. I just know their program is out there, so I hate to say anything I don't know.
What's the cost?
If you're paying a large amount like some people are, and within let's say 3 months' time with everything else, or even 4, you've met your donut hole with the regular insurance. Okay, then, let me back up, the drugstore knows that you signed up for Epic, they have that online. But I was told to show them the card every time you go and pay for your prescription. Once you meet the donut hole with your insurance, you have to meet Epic's donut hole.
Okay,
But believe me, it won't take long.
I understand there's 2 programs with that.
Yeah.
Okay, that's as much as I really know.
There's like, the insurance company, of course, they send you the sheets so you see. The prescription or what they were paying was $2,300. And I paid the seven grade bill. So wasn't long, all I had to pay was $20.
Well, that's why it's important for you, especially to check that out.
You said Highmark used to be one.
Blue Shield of Northeast New York.
Don't they call it Senior Blue too or something like that?
Used to be.
Yeah, there's different programs, absolutely.
Subject one time there.
Can I go back to your comment again about the issues that you personally were aware of? You see, you wrote 60-some or approximately 60-some in the last 6 months, and 55% of them was with Highmark,
50%.
or 50%, and then down and down. If those people were dissatisfied, would you have been the person that would have heard?
Absolutely. Yeah, I would have been the first person they called because you've got me. I'm not gonna retire. I am here until I die. I just love what I know. I do. My kids think I'm crazy. I'm a widow. I love my job. It's not stressful. I try not to make any appointments before 10 in the morning because I like to sleep to 7 o'clock these days. And why should I retire? I like to travel and I need to make money. So and I love to help people. So why should I go anywhere? So when I enroll you, I am yours until I'm gone, period.
Of those 50% that you said were Highmark, have you basically had no complaints?
I haven't had any complaints from one of my clients.
Not any of them, regardless of which one they chose.
Correct.
But 50% of them took Highmark.
Yes. That's just since January. It doesn't tell you what I wrote last year with Highmark.
No, I just,
Right.
because I'm very confused about, which one
Well,
I'm going to
absolutely.
choose at this point.
Yeah.
But what you're saying about Highmark, to me personally, is sounding quite good. But
The things I like about Highmark is the national network. That's number one. I mean, you can't go 99.9% of national providers accept it. That's a huge one. The hospital benefit's a big thing to me. And the dental, if you need dental coverage, that's, you get 1 crown today, it's $800. So, yeah.
well, I went to my eye doctor's last month and I put my glasses on. I still can't hear a bit better.
Well, folks, I know I overloaded you with information, but I wanted to get it out there, give you time to go through it. You've got almost a month to go through this before we make appointments to sit down. And like I said, once you go through it, if you come across something, you have a question, if I don't know the answer, I'll find it for you and get back to you. Sound good?
Yes.
You're not as much trouble as I thought you were gonna be.
We don't even know.
You don't know, Tony?
No, you.
That's okay, Brucey.
Well, thank you all very much. It's been my pleasure.
Thank you.
Okay. You gotta go to Colleen to sign up.
Thank you so much.
You're welcome. Nice to meet you.
We'll see you.
I'm sure Colleen will come up with a calendar and a date.
I didn't know whether.
We'll be in touch and I'll let everybody know.